Yeah, I think if we were to go through all the issues that we are concerned about, we might spend many more hours here than what we've scheduled for tonight. But yeah, obviously I'll go through the salient ones. But yeah, let's move along. So this was these were the title points that we sent out in the invitation. And the first one is this a cure that's worse than the disease? So I thought we would have a look at that. In defining it, though, we first have to look at what is the disease, and ultimately, we have a failing. Some might suggest a failed public sector, and in terms of the private health sector, high quality, but it's very expensive, and it's increasingly becoming more inaccessible to people in that space. The percentage of citizens on private cover is actually declining, in not even in real terms, but even in absolute terms. We have another major disease, and this is the disease that affects everything down the line, and that's a flagging economy. So we've been sitting at either low or no growth now for around 15 years. That puts a huge impact. We've gone backwards in per capita GDP, and that, as I say, impacts everything down the line. So the proposed cure from government is the NHI, but I certainly hope by the end of this evening I will show you that it will not be able to cure any of these diseases that are unfortunately ailing us as a nation. So why are we here now? And in very few short, simple words, it's the ideology of the ANC. And I think it's then worth unpacking some of that to have a look at. Like many post-revolutionary countries, and specifically where those governments start failing as they move into the nationalism space, which brings with it all its rhetoric and various other maladies. The ANC's version of it is known as the National Democratic Revolution. And what that requires is centralized control by the ANC of all the levers of power in society and in the economy. They already pretty much have it in terms of the legislative, public service, state-owned entities, security, education, and healthcare. But it wants to extend it more than that, and look towards much more civil society and private enterprise. I think the most extreme form of it we saw was in the EWC proposals. Those do seem to have sort of gone off the boil a bit, but they still, I think, officially stand there. And the other one, another big one, is this NHI proposal, which seeks to nationalize a multi-billion rand private healthcare industry, and not for any altruistic purposes, I can assure you. So the results of such an ideology, I don't think I'd need to remind anyone in this room that, we see obviously endemic patronage, massive corruption, and these are obviously maladies that cause their own set of problems. But in this process, institutions are put to the service of such patronage in every possible way that they can achieve. It's obviously up to civil society organizations like ourselves, plus the courts, plus various other parties, to try and limit that expansion. But it also means that more institutions must be found and captured to be put to that service. And the NHI is a perfect example of where they're seeking to find another institution that they can either create or take over in terms of doing that. I found this article, a quote actually, from an article by well-known political analyst R.W. Johnson, which I thought was quite apt. And he says this dominance of patronage has always meant that ANC policy is pretty malleable. I think we pretty much know that. And the party has a cloud of populist assumptions and populist policies. And on the subject of populism, let's have a look at that. Virtually in all cases, it's a zero-sum strategy. It doesn't build anything. It's often destructive. And it often has to create the narrative of victimhood and blame. And in the case of NHI, we have blame is being heaped on the private sector to say it's all the private sector's fault why the public sector has troubles, its own troubles. No evidence has been mounted by government to actually prove this. It's just a simple statement that they claim without evidence. The victim is obviously the Department of Health and the users of that system. So they're being denied healthcare because a private system exists in parallel. The result, nonetheless, is a vacuous but destructive policy. And I think I'll obviously go through some of the more details of that tonight. So the one aspect here is the NHI policy process has fundamentally incorrectly diagnosed the problems. I showed you what they diagnosed it as, but they've got it completely wrong. So the diagnosis is that public sector resources are insufficient, and I'll show you tonight how that's not true. The real problems are these, governance frameworks have been largely dismantled, and management capacity has, in many cases, literally been destroyed, which is why the public sector health department is in such bad array. Another diagnosis that they came up with is that South Africa needs universal health coverage. Throughout the NHI policy process, they've conflated achieving universal health coverage with implementing NHI. But I'll show you now in a few slides or two that South Africa already achieves universal health coverage. The problem is the quality of care that is being delivered. It's not its accessibility that's a problem. That's very fundamental, because the universal health coverage process is about reaching people, making it available. If the quality is poor, that's a whole different kettle of fish that we need to look at. But they've quite successfully woven that narrative, even amongst journalists and so you can read, they espouse the story, but in actual fact we have it, which then begs the question, why do we need NHI?